Hi, my name is Isabella Madayag, and today I will be presenting on the humerus. So here we have a photo of the humerus taken from the anterior view as well as from the posterior view. And from the anterior view, we can see the head of the humerus, which forms a ball and socket joint with a scapula or shoulder blade at the glenoid cavity. This allows us to move our arms in various directions. Immediately below the head is the anatomical neck right here. It is a groove that provides a place for the shoulder's joint capsule to attach. These small bumps, let's move to the more zoomed in photo. These small bumps right here are called tubercles. And these tubercles are small knobby structures that allow for attachment of muscles and ligaments. This larger knob structure is called the greater tubercle, and it is located laterally, while the smaller knob structure right here, located medially, is called the lesser tubercle. These tubercles specifically allow for the attachment of muscles in our back as well as the pectoralis major muscle. In between these tubercles is the intertubercular groove. The intertubercular groove extends down the shaft of the humerus. So this is the head, this is the shaft right here, and this is the intertubercular groove right here. This groove acts as a pass for the long head of the biceps brachii. This part of the humerus that connects the large proximal head to the skinnier shaft below is called the surgical neck. Not to be confused with the anatomical neck right here. The surgical neck is a little bit below, and the surgical neck is where the part where the tubercles morph into this one skinny shaft. It is called the surgical neck because it is one of the most common fracture points on the humerus, which means that we are more likely to require surgery if this part was broken. And usually on the posterior side of the humerus is a groove that runs down at an angle. And this this groove is called the radial groove. It is called the radial groove because it houses the radial nerve. Let me see if I can try it. I don't think we have a photo of it here, but this might be a little bit of the radial groove right here. Next is the triangle-shaped projection coming off of the shaft right here. And this little projection right here is called the deltoid tuberosity. Deltoid, which refers to our shoulder muscles, is where the deltoid attaches to the deltoid tuberosity. Toward the distal end of the humerus is a ridge that forms on each side. These ridges right here. And these ridges connect the epicondyles together. Below this ridge, toward the midline of the body, right here, is called the medial supracondylar ridge. And the medial supracondylar ridge allows for the attachment of muscles such as the brachialis and the triceps brachii. On the other side is the lateral supracondylar ridge. This allows for the attachment of various muscles as well, such as the brachioradialis and the triceps brachii. The coronoid fossa, right here, is near the middle of the humerus toward the distal end, and it is a depression or a small crater-looking structure. The fossa is there so that when we flex our forearm, the apex of the coronoid process, which is a bony prominence on the ulna of the forearm bone, will fit into this depression. Right next to it, laterally, is the radial fossa, and the radial fossa receives the head of the radius during forearm flexion. On the posterior side of the humerus, right here, we notice this pretty big depression, and this depression is called the olecranon fossa. Whenever we extend our forearm, this fossa accommodates the olecranon process of the ulna, which is the bony projection that makes up our elbow. The distal end of the humerus fans out into a left and right knobby structure. These are called the epicondyles. The prefix epi tells us that the structure is upon or over the condyles. Condyles refers to the rounded protuberances right here, known as the capitulum and trochlea, which we will go into more detail in just a minute. And the medial epicondyle refers to this ridge right here that is toward the midline of the body, as the term medial implies, and it is above the trochlea. The lateral epicondyle, on the other hand, is located toward the side of the body, just over the capitulum, and these structures allow for the attachment of various muscles of the forearm. Now, going back to the condyles, the capitulum is this small rounded protuberance that is located laterally on the distal end of the humerus. It articulates or forms a joint with the head of the radius bone in the forearm. And right next to it is the trochlea, located medially, and it has this little pointier structure right here. The name trochlea actually refers to a spool, which it looks like, and this is the part of the humerus that articulates or forms a joint with the ulna bone of the forearm. That is all for the humerus. Thank you for watching.